Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Chemotherapy Neuropathy. Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational workshop programs like this workshop. Educational workshops are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I introduce our workshop speaker. Dr. Chang is an assistant professor in cancer rehabilitation medicine at Oschin Comprehensive Cancer Center at Cedars-Sinai Medical Center. He has published on numerous topics in cancer rehabilitation medicine with a focus on pain management in cancer. Thank you so much for being here with us today.
Thank you so much, Rebecca, and everyone else at CSC South Bay for organizing this talk and for all the other great talks that you all organized. And thank you for having me today, and thank you everyone for joining us. As Rebecca mentioned, we're going to be talking about chemotherapy-induced peripheral neuropathy today, or CIPN. Honestly, there are multiple different kinds of acronyms and terminology that people use for this. So we're just going to be kind of going over different, basically just a background of what this is, and kind of different strategies that have been used to prevent this and treat this is really what we're going to be focusing on. Okay. So I do not have any disclosures, and to get right into it, I just want to start off with some definitions and terminology that I'm going to be kind of using throughout. So the first term is central nervous system. So when we talk about the central nervous system, that's just referring to the brain and the spinal cord. And that is in contrast to the peripheral nervous system, which is basically all the other nerves outside of the brain and the spinal cord. When we use the term, or when you hear the term peripheral neuropathy thrown around, that's just a general term that can really describe any number of disorders affecting the peripheral nerves or the peripheral nervous system, including neuropathy caused by chemotherapy. So again, peripheral neuropathy is more of just a general umbrella term. And same with polyneuropathy. Again, that's more of a general term or umbrella term that describes any kind of process or disorder that's affecting multiple nerves. And then you'll hear kind of the more specific terms of distal symmetric peripheral neuropathy, which is sometimes used interchangeably with the term distal symmetric polyneuropathy. And those are very specific kinds of peripheral neuropathy, which we will be talking about in a little bit more detail. So if this is something that you or someone that you know is dealing with, they may be using many terms to describe it, such as peripheral neuropathy, or polyneuropathy, or chemotherapy neuropathy, or chemotherapy-induced neuropathy, or chemotherapy-induced peripheral neuropathy. It's basically a lot of different words and a lot of different terms to describe the same thing. So again, this is the central nervous system, which is just consisting of the brain and the spinal cord. And again, this is a depiction of the peripheral nervous system. So, we have nerves that go basically to all the muscles and all the areas of skin on our body, and that's what lets us feel things, and that's what gives us motor function so we can move. So all these other nerves that are outside of the brain and the spinal cord make up what we call the peripheral nervous system, and that's where we get our terms peripheral neuropathy or distal symmetric peripheral neuropathy from. So when we talk about distal symmetric peripheral neuropathy or distal symmetric polyneuropathy, we are just kind of focused on these two words here, so distal and symmetric. So what distal means is that it's just an anatomic term, and basically it just means that It's to express or talk about a part of the body that is further away from kind of the center part of the body. So kind of the distal aspects of our limbs, or the distal most aspect of our limbs are going to be our hands and our feet, because those are the parts of our bodies that are kind of furthest away from the center of our body. And then symmetric means that's just kind of affecting both sides relatively equally. So when we talk about, again, distal symmetric peripheral neuropathy or distal symmetric polyneuropathy, we're really talking about a kind of peripheral neuropathy that is affecting the hands and the feet. Sometimes it can be affecting a little bit further up, like including the forearms, or perhaps including the lower legs, in rare cases, maybe the thighs. But really it's most often in the hands and the feet. And this is the kind of neuropathy that occurs in chemotherapy-induced neuropathy most of the time. So the vast majority of the time, chemotherapy-induced peripheral neuropathy is a kind of distal symmetric peripheral neuropathy. That said, chemotherapy is not the only cause of this kind of distal symmetric peripheral neuropathy or polyneuropathy, but there are several different causes of this kind of neuropathy. So these are some of the more common conditions that can cause it, with the most common ones being diabetes or prediabetes, but typically alcohol use, a lack of B12, the vitamin B12, chronic kidney disease, different kinds of genetic conditions, something called monoclonal gammopathy, can also cause the same pattern of distal symmetric polyneuropathy. So you'd have the similar symptoms, but they all have different causes. And the truth is there are many other causes of this as well, including many different kinds of, again, genetic disorders, as well as toxins that somebody may be exposed to in the environment. It's just important to know this because, most of the time, it may be very clear that you are totally fine. You didn't have any symptoms before starting chemotherapy. And then once you start chemotherapy, then you start to get symptoms. Then, it's more or less a clear-cut case of, the chemotherapies will cause the neuropathy. But sometimes maybe, the symptoms get worse, or it's been a couple of years and things are like not improving, but they're getting worse. In those kinds of circumstances, it'd be important that you work with your medical team, your doctor, or maybe even seeing a neurologist who would be able to work you up for these different causes or possibly other causes, because some of these things may be reversible, such as like a vitamin deficiency, whereas others may not. But at the end of the day, it's just very important that you, if there is another different cause outside of chemotherapy, that you find out what it is, because the treatment and the overall method of stopping or preventing worsening of the neuropathy symptoms will be by addressing whatever the underlying cause is. Okay, so when we talk about symptoms in distal symmetric peripheral neuropathy or chemotherapy-induced neuropathy, we often break up symptoms into two categories, and those are positive symptoms and negative symptoms. So positive symptoms is basically something that develops that was not there before. So those are going to include sensations of pain, burning, tingling, pins and needles, as well as cramps, whereas negative symptoms are things that are lost. So that's primarily just numbness as well as loss of sensation. And one of the primary reasons why we kind of categorize symptoms as either positive or negative is just because the treatment is sometimes a little different, just because the negative symptoms tend to be harder to treat than positive symptoms are. Okay, so timeline, again, really how we kind of correlate the neuropathy as being caused by chemotherapy is by the timeline. So, you shouldn't have hopefully any symptoms before starting treatment. But it is possible that as soon as that first cycle of chemotherapy, that either during it or sometime after the infusion, you could start to develop some of these positive negative symptoms. And more often than not, it's basically either numbness and tingling or pins and needles in basically the fingertips, so like the pads of the fingers as well as the toes. That's usually how it starts in, I'm gonna say almost everyone, although sometimes some people can have a particularly severe reaction, and they could be like the entire foot or the entire hand. It just kind of differs from person to person. And then with subsequent cycles, it is one of those things where the more exposure you get to the chemotherapy, then the more likely it is to occur. So a lot of people, they won't get any symptoms with their first cycle or maybe even their second cycle, but they can start to develop symptoms maybe after their third cycle or maybe after their fifth cycle or maybe after their ninth cycle. So symptoms can kind of occur and maybe more likely to occur kind of the more cycles and infusions that you get. So after chemotherapy finishes, it is still possible to get onset or worsening of symptoms. And even months after you have finished chemotherapy, so in most people after finishing chemotherapy, and it's been several months, your symptoms should get better. However, in some people, it is possible for the symptoms to worsen or even start. It's possible that you had no symptoms at all during all of chemotherapy, and then maybe 3 months later or 5 months later, you just start having neuropathy symptoms, even though you finished chemotherapy months ago. Again, in that kind of situation, it'd be important that you talk to your doctor and your medical team to make sure that there's not another potential cause of the neuropathy, but it could still be from the chemotherapy. And the reason for that is because of this thing called the coasting phenomenon. So the coasting phenomenon is where you get either onset of or worsening of neuropathy symptoms even after you finish chemotherapy. And this typically occurs in patients who are receiving vinca alkaloids or platinum-based chemotherapies. And these are kind of the common forms of chemotherapy in the parentheses here. So again, if you are having this, it's important that you do discuss with your medical team to make sure that there's not another cause. But this is something that we see, and this is a chart here from a study that was done. Basically, they were looking at different symptoms that people experience from chemotherapy neuropathy, including like tingling, pain, numbness. And basically, towards the top here, this means that you have less symptoms. And if you go more towards the bottom, this means you have more symptoms. And this entire grayed out shaded area represents the period of time after chemotherapy has been stopped. So this is the period of time after chemotherapy stopped. And you can see that for a lot of these kinds of symptoms, after people stop chemotherapy, they still had worsening of tingling or numbness or sometimes pain. So these are all things that can happen. Again, more commonly with the vinca alkaloids and with platinum-based chemotherapies, but this is certainly something to consider if you're receiving one of those types of chemotherapy. And again, you have onset or worsening of symptoms like months after you've completed chemotherapy. Okay, so moving on here, what causes chemotherapy induced peripheral neuropathy? The truth is it's multiple different things, and we don't completely understand all the mechanisms behind why this occurs, and it differs depending on the type of chemotherapy that's being given. So different kinds of chemotherapy will have different reasons for causing neuropathy. But at the end of the day, it's because chemotherapy is toxic to nerve cells. This is by no means a comprehensive list of the different mechanisms behind chemotherapy neuropathy, but it does represent some of the mechanisms. So just kind of briefly go through this. For platinum-based compounds, for instance, chemotherapy, these kinds of chemotherapy can prevent RNA synthesis, which basically is what cells need to be able to make specific kinds of proteins. Several different kinds of chemotherapy can cause damage to the mitochondria, and mitochondria is really important because it's the powerhouse of the cell, and it's where the nerve cells basically get their energy from. Platinum-based compounds have also been associated with inflammation to the areas around the nerves. For people getting like a taxane type of chemotherapy, taxanes have been shown to impair axonal transport. So if we look at our structure, this is the structure of a typical nerve cell that we also call a neuron. So this is the cell body, and this is kind of the nucleus where all the DNA of the nerve cell is held. And then we can see that there's these very, very long axons. This is what we're talking about, this axon, when we're talking about axonal transport. When there's a disruption from the chemotherapy, then materials cannot be transported in and out of the neuron as easily. And then when we talk about axonal demyelination, what we're talking about are there's these special kinds of cells called Schwann cells, and they basically wrap around the axon. And the purpose of this is because when you have this type of myelination, we call this the myelin sheath that's provided by these Schwann cells, then you basically get faster conductivity of electrical signals through the nerve cell. That's basically how our nerves work. They're basically the electrical systems of our bodies, and when the nerves give off electrical impulses, then those electrical impulses enter our muscles, and then our muscles will twitch and let us move. But essentially, when if you have taxane based chemotherapy, then you can get demyelination or destruction to this myelin sheath, so the nerve signals do not conduct as fast. And then also, you can again have damage to mitochondria. So there are many different reasons, again, why neuropathy occurs because of chemotherapy, and it differs based off of the type of chemotherapy that somebody might be receiving. What usually happens in most people? So typically, in most people, they will have improvement or resolution of their symptoms within weeks to months. And it takes a really long time because nerves just heal really, really slowly. Kind of the saying is it's like 1 millimeter per day of growth. So you think about if you have damage that might be as long as like a foot, that could take like a year to recover. But in most people, they will get better. Some people will have persistent symptoms, and sometimes that can last several years. However, at least anecdotally, I can say for people that I've seen in my practice is that even when people do have persistent symptoms that last years, assuming that there's not another secondary cause of peripheral neuropathy, the trend seems to be that it still can slowly get better over the course of years. So we'll be talking about this a little bit later in terms of the functional deficits that can be caused by chemotherapy-induced peripheral neuropathy. But one of the things that can happen, as many of you might be aware, is that it can affect your balance, and it can affect your ability to use your hands and your fine motor coordination. So I've seen people that had neuropathy so bad that they couldn't, their hand coordination was so impaired that they weren't able to tie their shoes. And 9 years after finishing chemotherapy, they weren't able to tie their shoes because they still had that severity of impairment. However, 10 years afterwards, they were able to tie their shoes again because their symptoms just got better. So, if you kind of fall in this category of you've had these symptoms kind of going on for years, again, if there's not any other underlying causes worsening the neuropathy, the trend seems to be that even when it's persistent, it can get better over time. So I think that's an important thing to keep in mind. So we can see here in this really nicely organized table that the incidence of this kind of neuropathy differs based off of the kind of chemotherapy you're receiving. And for some of these, it's quite high. So if you're receiving oxaliplatin, which is commonly used for GI related cancers, the chance of neuropathy occurring is quite high, as well as for some of these taxanes. But again, we see that a lot of people will usually have resolution of their symptoms within weeks to months. Okay, so moving on to prevention, there are several different strategies that have been purported to help prevent the formation of chemotherapy neuropathy. And if you just Google it, you Google like, how can I prevent chemotherapy neuropathy, or what kind of supplements should I take? There's going to be like a laundry list of things. So this is just a list of several different supplements that people say may help prevent chemotherapy-induced peripheral neuropathy. And the truth is, to date, none of this has actually been definitively shown to actually help prevent chemotherapy neuropathy. That said, if you do feel inclined to try one or several of these supplements, it's just important that you discuss that with your oncologist beforehand, and that they make sure that that particular supplement does not have any interactions with your chemotherapy regimen or any other medications that you're on, because we do know that supplement and drug reactions and interactions is a very real thing. So they just have to be aware of anything that you are taking. So moving on here, I do want to discuss a few topics in particular that kind of are asked about maybe a little bit more frequently regarding chemotherapy neuropathy prevention. So we'll be going into each of these in a little bit more detail. So acupuncture, we get asked about acupuncture all the time. And acupuncture is great. It helps with, it can help with a lot of things, particularly anxiety and fatigue. But it has not been shown there. Number one, there have not been that many studies that have been done in regards to its ability to prevent chemotherapy neuropathy. But in the small studies that have been done, it was not shown to prevent chemotherapy neuropathy, and guidelines from several European societies, including the European Society of Medical Oncology, European Oncology Nursing Society, and the European Neuro-Oncologic Association. They actually discourage the use of acupuncture in preventing chemotherapy neuropathy. That said, if you're using it for a different purpose, like I said, anxiety, and musculoskeletal pain, it has been shown to help. The only thing that I would caution is that a lot of people will recommend, there's no consensus for this, but in general, people recommend that your platelets should be above 75 if you choose to pursue acupuncture for whichever purpose. Okay, the next thing that gets a lot of attention is cryotherapy. So cryotherapy is basically the use of basically cooling down to very low temperatures the areas of the body that usually develop neuropathy symptoms. So again, because it's a distal symmetric polyneuropathy, that's both hands and both feet. So the thought process behind this is that when you cool down any area of the body, it causes the blood vessels to constrict and become smaller. And if you do that, then maybe the thought process is that the chemotherapy won't be able to get to your hands and feet as much, and then maybe the nerves there will be protected and you won't develop the neuropathy symptoms. So this is probably the most used form of prevention for chemotherapy neuropathy. And most of the studies have been done in patients who have gotten platinum-based chemotherapies, vinca alkaloids, or taxanes. So these, you can get these like off Amazon, or whatever other kind of online shopping market you go to. But basically, you freeze these, and the idea is you have like a little cooler. You freeze these, and you have multiple packs because once you have it on for a period of time, it'll slowly kind of melt and get to room temperature. So you'll need multiple packs of them. And this has the data regarding the usefulness of this cryotherapy and preventing chemotherapy neuropathy. It's a little mixed. So some studies have shown that it does help. Other studies have showed that it does not help. That said, I do have multiple patients who use it, and some of them feel like it does help. So if you feel so inclined, this is definitely something you can consider. That said, this is a really, really difficult thing because you're wearing frozen gloves and frozen booties essentially, and it becomes very uncomfortable, especially if you're doing it kind of correctly. Frostbite is definitely a concern. And the truth is, in some of these studies, a lot of people who were participants in studies, they just weren't able to tolerate it because it's pretty uncomfortable to have frozen gloves and frozen socks on for a period of time. That said, there's also no standardized protocol for how you should do this. So there's no standardized, glove. There's no standardized booty. There's no standardized temperature of how low you should be making how low of a degree you should be making your hands and your feet. And there's no standardized time set So a lot of the studies had people wearing these gloves basically 15 minutes before the infusion, and then wearing it all throughout the infusion, and then keeping it on until 15 minutes after the infusion. A lot of those infusions were like an hour long. So you're keeping this on for an hour and a half. But again, there's no standardized protocol for this. That said, there have been several studies done, and some of them show that maybe it might help. So it's something that you can certainly look into and talk to your oncologist about. Okay, the other thing that gets more kind of attention is compression therapy. So this works in a very similar way. And the idea is, again, you're just restricting blood flow to the areas of the hands and feet. And you basically do this by, in some of the studies that were done, they basically wore like surgical, like compression gloves. And you basically just wear gloves or socks that are too small. And again, you're just kind of limiting blood flow to the hands and the feet. Again, there is a little bit of positive evidence for this, and there's actually also now starting to be some studies where they combine the two. So you do both compression and you do cryotherapy at the same time. And I think there's at least one study underway for that. Yeah, again, it's not definitively proven yet. Exercise is another thing that they've looked at, and there's one study in particular that basically had patients do 3 types of exercise, including aerobic training, postural stabilization exercises, as well as strength training. And basically, in terms of the incidence of chemotherapy neuropathy occurring, was 44% in the non-exercising group, but 30% in the exercise group. So there's a trend indicating that exercise may be beneficial for preventing chemotherapy neuropathy, but the difference that they found was not statistically significant. That said, exercise has a wide-ranging wide range of other benefits, including helping with fatigue, anxiety, depression, bone health, lymphedema. So we recommend that you do this regardless. And then, plus minus, maybe it might be helping to prevent your neuropathy, maybe not, but it will help with these other things. And then finally, I just want to briefly mention GM1 or ganglioside monosialic acid. So this is not available in the United States, but it's more so been used in some studies in China, but some of you may have heard of this. It's thought to be protective to nerve cells, and a few small studies have suggested that maybe it could reduce the severity of neuropathy that occurs. Okay, so that said, ASCO, which is the American Society of Clinical Oncology, that's like the really big oncology cancer doctor organization in the United States. They looked at all the different studies that have been done for prevention and treatment of chemotherapy neuropathy in 2020, and they published this paper. And basically what they found was that there's not enough evidence to really support the recommendation of any of these things for preventing chemotherapy-induced peripheral neuropathy. So that's the stance of ASCO. And this is basically also in line with what the other European society, the similar European societies have said, that again, there's no effective agent that currently exists to prevent chemotherapy-induced peripheral neuropathy. So no positive recommendations can be made for any of these things. But that said, a lot of people still do certain things, and you can too. I would just recommend that you discuss it with your oncology team first, just so that they're aware that you're doing it. And if you're trying to use something like a supplement or something, again, we just want to ensure that there's no possible interactions with your treatment regimens. Okay, so that's everything for prevention. I'd like to move on to treatment of chemotherapy neuropathy. I want to divide this into the different kinds of symptoms that occur. So again, we talked about negative symptoms. That's where you lose something like numbness or you have loss in sensation. Positive symptoms, that's like the occurrence of a new feeling like burning or tingling. And then I also want to talk about treatment for functional deficits that can occur. And again, the most common things we see are difficulties with balance, difficulties with walking, sometimes weakness, and also fine motor impairment. So that's like difficulty using your hands for fine motor skills like writing or typing on a keyboard, for instance. So again, with negative symptoms, there are fewer treatment options available, and it's just not looked at as much. The symptoms that people tend to look at more like pain and burning and tingling. But some studies did look at numbness as an outcome measure. And these things, duloxetine, which has a trade name of Cymbalta, pregabalin, which has the trade name Lyrica, have both been shown in some cases to help with numbness for some people. Exercise has also been shown to help, and scrambler therapy, which we'll be talking about in a little more detail, has also been shown to help. Okay, now moving on to positive symptoms. There's a lot of different treatments that are available for positive symptoms. Some of these have basically no evidence supporting it, but a lot of them do have evidence supporting it. But the point is, if burning, tingling, numbness, or burning, tingling, pain, or pins and needles sensation is something that you're dealing with, there's a good chance that there's something out there that can at least alleviate the symptoms somewhat. So the first thing that I'll talk about is scrambler therapy. So this is like a scrambler therapy device. And this is basically a kind of therapy where they do electrical stimulation to the body. So they'll take these pads that kind of look like the pads that you might get if like you're getting the EKG of your heart, and they'll put them like on the areas where you have symptoms like your legs, and essentially they will through those pads they'll deliver like electrical currents to the body. There's some promising research actually stating that this can be helpful as a treatment for chemotherapy neuropathy. It's not widely available. UCLA does have it, and they do take certain kinds of insurance. You can, if this is something you're interested in considering, you can tell your doctors, and they can, like UCLA has a website that they can go to directly refer you for this treatment. There are some clinics in Los Angeles that do offer this privately, but just note that it can be expensive. But if you just Google search scrambler therapy Los Angeles, it's something that is also available privately. Next is pharmacologic treatment. So there's several different kinds of medications. That one publication that we talked about from ASCO, the American Society of Clinical Oncology, the only medication that they actually gave a positive recommendation for was duloxetine, again, which has trade name Cymbalta. And this is thought to be the most useful medication for treating peripheral neuropathy. But for whatever reason you can't take that. There are several other medications that can be tried. And these are generally just different medications that we give for neuropathic pain or nerve-mediated pain, and those include gabapentin, pregabalin, amitriptyline, nortriptyline, and Effexor. Cannabinoids can also sometimes be given, and these are going to be like marijuana-based agents like CBD and THC, usually which we would recommend given as a tincture or possibly an edible. We generally do not recommend anybody smoke any kind of cannabis derived agent. There are several different kinds of topicals. So a lot of times for people that have like, kind of more severe burning or pain, one of the first things, and there's not as much evidence for this, but this is more just my clinical practice, but I just recommend topical lidocaine. And it doesn't honestly matter that much whether it's 4% lidocaine or 5% lidocaine. But sometimes for some people, this can be really helpful. This is all over the counter. You can get this off Amazon, or you can go to any retail pharmacy and you can get these. I wouldn't say that there's one brand in particular that helps people more or less. But yeah, just it could be really any kind of 4% lidocaine. Another topical that I frequently recommend is topical menthol. And again, this is for people who have more of a burning type pain. And menthol is basically like the cool minty kinds of agents that you see in many different kinds of products. So I've had a couple people tell me that this particular brand, Conquer Neuropathy, has been useful. Biofreeze tends to have like a higher percentage of menthol in it, like generally like 10 to 14%. Then if you're looking for something that's a little less potent than Tiger Balm, I think in general has like a lower percentage of menthol. But for some people, this can be helpful. And again, this is all available over the counter. Something that has been shown there's a little bit of evidence that, again, topical CBD, THC derived from hemp or marijuana can be helpful. This is one that I previously recommended in the past, and the reason why I recommended this particular one is because it had the closest concentration to one study that was previously done. This is a brand that I know was available at CVS before, but I'm not sure how easily you can find this. These days, I'm recommending this one much more. It does smell like marijuana, which can be off-putting to some people. However, this one has been shown to be helpful. It is also more expensive. This is going to this Papa Barkley Relief Balm. It's yeah, maybe probably somewhere in the range of $40 to $80, depending on where you go. But these kinds of CBD THC bombs can be found in recreational marijuana dispensaries. There are special compounding topicals, which are basically you'd have to go to a specialized pharmacy, which like kind of custom creates medications. And they can mix any kind of combination medications for you. And these have been studied too. The studies have not really shown that these have been very helpful, but for some people, they do feel like it helps. A common mixture that we might recommend might include these medications all here. The negative things about this is that I would say, again, you have to go to a specialized pharmacy, so you have to find somewhere that can make this for you. It's expensive. A month-long supply might range somewhere between $100 and $150. It doesn't last that long. A lot of times, it'll expire after like maybe a month or a couple months. Those are all things to keep in mind. But again, maybe for a few select people, these things could be more helpful. Okay, the last topical that I want to talk about is capsaicin. So capsaicin is basically a topical cream that's derived from like spicy, like chili peppers. So the way that this is believed to work is that it basically activates all the receptors in your skin, and it kind of overactivates the receptors to the point where it becomes like desensitized. So you can get these creams over the counter, but the strengths, as you can see here, are pretty low. It'll range from like, 0.01% to, 0.1% or something like that. Now, there is a prescription grade of this kind of topical, and it's given through a patch, and the trade name for this particular high-dose capsaicin patch is Qutenza. That's Qutenza. And it's basically 8%. So this prescription patch is essentially 200 to 300 times more potent than what you're able to get over the counter. And this is a study that they did testing its use for chemotherapy peripheral neuropathy. So again, they wanted to see if the high dose patch would be helpful. So they recruited 18 patients that had peripheral neuropathy caused by oxaliplatin, and then they looked at their pain scores caused by the neuropathy at basically a week, 8 weeks, and then 12 weeks. And what they found was that pain scores, and again, so this is basically patients who received a lower dose of capsaicin versus patients who received a higher dose of capsaicin. And you can see that the pain scores at basically all time points were significantly lower in the group that received the high dose capsaicin, and that their overall pain reduction percentages were higher. So meaning that the higher dose capsaicin seemed to work better. So they just concluded that high dose capsaicin seems to be an effective treatment for chemotherapy neuropathy caused by oxaliplatin specifically. That said, this is something that we've been doing much more frequently in our clinic, is treatment with this kind of patch, and it does seem like it's pretty effective. One of the positive things about it is that there's not very many side effects because it's just a patch. Maybe less than 1% of people could develop maybe some nausea or like nausea, vomiting, and dizziness. And then the most common thing is that everybody will generally have burning, increased burning in their feet because again, it's derived from spicy peppers. Maybe from like 48 to 72 hours, maybe at most like 5 days. But other than that, there's really no other side effects. So this might be something that you want to ask your medical providers about. If this might be a good treatment option for you. The other good thing is that it's usually just done once every 3 months. So you literally just leave the patch on for like an hour. And then, it's usually done in your medical provider's clinic space. So you go there, they put the patch on for an hour, you take it off, and then, you're good. And then you might consider getting a repeat application like every 3 months. But that's another thing to consider. But I do think that is more, this seems like it's been helpful for a lot of people. Another thing, this is more so if you're really, really, really like you've tried a million other things and it seems like nothing is helping, then you can consider botulinum toxin injection. So there's very limited evidence for this, and it's not usually covered by insurance, but sometimes you can find some people that can do it privately. But generally they'll inject a little bit of Botox into the skin of the affected areas, kind of in a grid-like pattern. Next is photobiomodulation. So photobiomodulation is like a kind of like light therapy, specifically red light. And there's like these kinds of devices that basically shine the red light. And there's a little bit of preliminary evidence that this can help with nerve-mediated pain as well. Most of the studies that have been done using for photobiomodulation are actually for musculoskeletal type pains, like sore muscles or painful tendons. But again, a little bit of emerging evidence that maybe it could be useful for neuropathy. There are some private clinics, again, in Los Angeles that provide this kind of therapy as well. You can just Google search like laser therapy Los Angeles or low-level laser therapy or photobiomodulation therapy Los Angeles, and you might be able to find some clinics. Next is extracorporeal shockwave therapy. So this is basically this is one that I'm not too familiar with. I actually just found out about this one recently. So I believe it just works through kind of very fast, almost like sound waves that can like basically break up tissue. I know that they use this more for patients with like tendon problems. But again, some emerging evidence that this may be useful for neuropathy. I don't know too much about this. But I do know that there are some clinics out there that utilize this technology as well. Again, very, very limited evidence, but if you tried like a million other things and nothing's worked, then it may be worth considering. And then again, acupuncture. So we said it was not recommended really as a prevention strategy, but it has been shown to have more benefit as a treatment. So one thing to note is that in general, a lot of studies will have people doing acupuncture for like at least generally like 8 weeks. So I wouldn't, if you're wanting to try this, I wouldn't just try once and then say like it didn't help me, but I would try it for at least several weeks. And then therapeutic exercise, which we kind of talked about. And usually therapeutic exercise is a combination of both resistance training in addition to aerobic training. And then I also want to talk about these basically have very limited to no evidence, but some people anecdotally, they do feel like it helps them. So there are special kinds of socks. Like you can see like the toes are cut out from these socks. This is a special kind of sock called Vox, VOXX. And I think they have some evidence that their socks help with people suffering from diabetic neuropathy. But some people find these useful and it's relatively harmless and these special socks might be somewhere between $20 to $30 but yeah, for some people, select people, maybe it could be helpful. These are things that I recommend more for people who have cramps. Like if you're feeling like you have a lot of cramps, like maybe in the ball of your foot or your toes. Again, this is not really evidence-based, but I've just found this for some people with like cramps, and more so in the forefoot, that these can be helpful. They're called metatarsal pads. And it'll just be like this kind of thing that goes under the ball of your foot. So this could be something helpful. You can get these from some like retail pharmacies, but you could also get these off Amazon. So another thing to consider. Supplements, again, no supplements have been found with proven benefit. That said, a lot of people really commonly take the supplements alpha lipoic acid and vitamin B12 or some kind of B complex vitamin. And a lot of medical providers might even recommend this. Again, there's not great evidence, but this is done. Again, you just want to be cautious before starting any of these kinds of supplements and just talk to your oncology team to make sure it's okay with them before starting. Because again, some of these supplements may have interactions with some of the treatments that you may be receiving. I'd also like to note that, B complex vitamins, usually they have B1, B6, and B12. And if you take too much B6, that actually causes neuropathy. So you just want to be careful with they say that the difference between cure and poison is dose, and that's very true. So you just want to be careful with how much of any particular vitamin you're actually taking. Okay, so with that, I'd like to quickly go over the different kinds of functional deficits that can occur. So again, with the hands, it's like difficulty with things like typing or texting. You might drop things. You may have difficulty picking up small objects. With your feet, it's usually difficulty walking or poor balance. You might have falls or feel like, you might fall. These are things that we all really commonly see, and this is because of altered proprioception. So one of the abilities that our nerves gives us is proprioception. And proprioception is basically an awareness of where your muscles and joints are in three-dimensional space without looking. So it's a large part of what gives us our sense of balance. And this proprioception is very, very commonly diminished in chemotherapy-induced neuropathy, and it's why you get kind of all these difficulties with these tasks that we just mentioned. So a lot of what we do for this is just utilizing our friends in skilled therapy. So if you're having problems with leg weakness or balance or walking, then it's highly recommended that you see a physical therapist who will help you with those tasks, help with strengthening, help with balance exercises. And oftentimes, if people just go to like 6 to 8 weeks of physical therapy to kind of work on their balance, it will get better and those tasks will become easier. Same thing for occupational therapy. And there's actually a special type of occupational therapy called hand therapy. And again, if you're having weakness or if you are having difficulty with specific tasks like writing or typing, you can go through a course of hand therapy, which your medical provider could refer you to. And a lot of times this will help, again, with strengthening tasks as well as fine motor tasks. Just to mention, if you are having like a lot of trouble with balance, if you're having more severe symptoms, then it is recommended that maybe you get some kind of assistive device to help you with your balance. If you have a fall, that could be really, really bad. So, whether a cane or a walker or trekking poles, just something to be able to assist with your balance. And these are things that your medical teams or perhaps a skilled therapist, like a physical therapist, could make recommendations specifically for you. For those who have significant weakness, which is less common but can occur with chemotherapy neuropathy, you may want to consider, getting a special kind of orthotic or brace, depending on where you're weak. And if you're having a lot of trouble with balance, it may be even prudent, especially if you're going outside, to get a gait belt. These are something that, is basically tie around your waist, and hopefully you're with somebody and walking with someone, they could kind of grab onto you and help you steady yourself in balance if needed. But these are all things to consider. So that's basically everything that I had. So I'd be happy to answer any questions if there are any.
Yes, thank you so much, Dr. Chang. That was such a wealth of information. So we do have a couple of questions in the chat box. I'll just go in order.
Yeah, okay. Okay, so I see the first question is, does it matter if the neuropathy came on due to chemo? I'm going to say yes, insofar as that you want to know what's causing it, because that will help you, stop it to a degree. So if you know it's from chemo, then, once you should expect to some degree that once you're done with chemo, that it should get better, hopefully with time. But if you're not sure, then you want to look for a different cause, because, depending on what that cause is, you'll treat it and address it differently. Again, if it's a vitamin deficiency, you'll do that vitamin. If it's related to a thyroid problem, then you have to get the thyroid checked out. If it's due to like some kind of toxic exposure, then you have to, find out what that exposure is, where it's coming from, and stop your exposure to it. So I'm going to say, yes, it does matter kind of if it's coming from chemo or something else. Next question is, what are negative symptoms? So again, negative symptoms are when you lose something. So it's typically we just describe it as either numbness or loss of sensation. What about motor function loss post-infusions? Can that resolve? Yes, I have seen, again, motor function loss is not as common, but if you're talking specifically about muscle weakness, but it definitely does occur in some people. Yes, that can improve. I have seen it improve significantly in some people before, to the point where like they could barely kind of lift up their ankle to the point of like them recovering full strength. But again, that can take a really long time. Sometimes like 1 to like 3 years. And again, in some people, it can be persistent. Okay, next question. I fit the description of the coasting phenomenon. What if the nerve conduction test was normal? So that's interesting. Yeah, so typically The nerve conduction test, it's not, I assume you're talking about like nerve conduction study electromyography, like an NCS EMG test. As far as I know, it's not like necessarily the most sensitive test, because we've definitely ordered that on people and it's normal, but they still have symptoms. So I'll say it's not, yeah, it's possible that, it's just, the damage done by the chemotherapy was not enough to show up on the nerve conduction study test, but it doesn't mean that you don't still have nerve damage to some degree. It was just undetectable by it. So I would think something like that, but I would encourage you to talk more specifically about the reasons for that with the neurologist or whoever performed the nerve conduction study test. Next question, is it possible to get symptoms years after chemotherapy is stopped? I'm going to say, as far as I know, no. I don't know how many years you're talking. If it's like 1 year, then I'll say like yes. If it's like 10 years, I'm going to say probably no. And you should definitely look at a different cause. Next question. I am 5 years post-chemo and I still have persistent numbness and tingling in my hands and feet. What, if anything, can be done to treat these symptoms? So it sounds like, there's both negative and positive symptoms there. I would encourage you to kind of like re-look through the slides that I talked about. As we know that for positive symptoms, there are many different kinds of treatments, including the topicals, the oral medications, as well as kind of all those other things like scrambler therapy and acupuncture. So I would, yeah, I would maybe recheck the slides to go through those things. Next question is, does capsaicin damage the nerves? No, as far as we know, there's no damage done to nerves by capsaicin. The next question, does this help for negative symptoms? I'm assuming that we're talking about the high dose capsaicin there as well. In general, I'm going to say not as much. We've seen it more help for people with sensations of like burning, tingling, and pain. That said, there's a few people, maybe a handful of people, that did feel like it did help for negative symptoms. So I'll say it can, but I would say it's not expected. Next question, to get further information, is there a specialty for neurochemo medicine? Not that I know of. So there are certainly some neurologists that have more experience in this area. And specialties like the one I'm in, cancer rehabilitation medicine, definitely has more information in this specific area. But as far as I know, there's no specific neurochemo medicine specialty. Next question, can neuropathy and nerve damage be permanent? So we think yes. I've definitely seen people in, again, who have persistent symptoms like 10 years, like 15 years after finishing chemotherapy. So yes, it can be. But again, even when it doesn't mean that it can't get better. Again, if there's not any other reversible cause or there's not any other identifiable causes and it's just straight from the chemotherapy, you'd expect for it to get better over time. And I've definitely seen that before in people. So even if it seems like it's permanent and it's not going away, it doesn't mean that very, very slowly over the course of years, it can't improve still.
Thank you so much. Are there any other questions? You can feel free to put them into the chat. You can directly message Dr. Chang if you prefer, or myself. If you unmute yourself, then I can also call on you if you prefer to ask your question orally. Yes, Steffi, go ahead.
Oh, yes, I have a question. I have I've developed a motor issue after completing my my chemo and directed infusion therapies. So I think I'd like to see it if I could see a specialist who only knows about chemo and neuro. I had an EMG done, and it seems like there's some cervical issues that have arisen possibly from the tumors that I had that might have interrupted the nerve connection. So I'm wondering if is Cedars-Sinai one a neuro? Is there like a contact for that that I could get in touch with someone there?
Or,
would you recommend?
yeah, I mean, there are definitely several neurologists at Cedars-Sinai. I mean, it sounds like if there's issues involving kind of the cervical spine area that could be
Yes.
affecting either nerves or the spinal cord at that level, then you're right. It does become more complicated. It may not only be from the chemotherapy, there could be other causes.
Well, from the
of
tumor,
symptoms.
I'm thinking, yes.
Okay, so yeah, if there's
Possibly.
any kind of impingement of the nerves or the spinal cord, then it's not so simple as just being only chemotherapy and neuropathy first. I mean, really, in that kind of case, you had to be seeing a neurologist. Yeah, I don't know of any specific like chemotherapy or cancer specific neurologists, but yeah, it would be important to, I would say, be getting input from a neurologist and possibly a neurosurgeon to see, if they are feeling like the deficits are more from impingement, compression on the nerves versus from like a chemotherapy or other toxin. Additionally, another thing that could be helpful is kind of that EMG and nerve conduction study test that we were talking about, because sometimes that can help differentiate between when it's able to detect a problem in the peripheral nervous system, it could shed light because it could actually potentially show damage in the peripheral nervous system versus where if there's damage that's only to the central nervous system, the nerve conduction study test will generally be normal. But what I would say is if you're specifically looking like at Cedars-Sinai, I mean, there's there are several neurologists who are quite good, but yeah, as far as I wouldn't say there's any chemo oncology specific one. But if you're looking for a name, I would say Alana Lasner, somebody who I work closely with, and she sees a lot of her patients with cancer, and I would say she's quite good.
Elena Lasner, you said?
Yeah, Alana Lasner, Lasner. There's another neurologist I've been working with a little bit more. Her name is Jody Nelson, Nelson. I found them to be both quite good.
Oh, wonderful. I'm going to go following up with that. Thank you.
Of course, but again, I don't know how far away you are from them. There's probably there are also probably neurologists who are quite capable, if that would be closer to your area as well.
Yeah, I'm in San Diego, so it's not far at all to get up to Cedars-Sinai.
Okay, or yeah, I would just say that like UCSD, I'm sure they also have neurologists who are more than capable with working up your situation.
Okay.
But I would just do a quick Google search. And honestly, if you're getting your oncology care, like at like somewhere like UCSD UCSD, they're probably like you could probably ask your oncologist, and they'd probably be able to refer you to someone who they already know and like. But of course, you're more than welcome to come up here too.
Okay, I will do that. I'm seeing two oncologists next month, so I'm going to see one and then get a second opinion. So
okay,
yeah, I will be in touch. It's a good idea. Thank you very much for your time and for this is so helpful. Really, you're doing a good deed. Thank you.
Of course, happy to help.
Thank you. We have one more question from Richard. Go ahead, last question.
Yes, I'm 5 years post chemotherapy, and the symptoms in both my hands and feet, if anything, have accelerated. Now, I have tried topical ointments, even Vicks Vapor Rub, which gave me temporary relief. Would you recommend I consult the neurologist to see if there's anything that can be done which is more aggressive than what I've been trying?
If you feel like your symptoms are accelerating or worsening, I would recommend that you see a neurologist for further workup to see if there's something else potentially contributing to it. Because again, if it's just from the chemotherapy, it shouldn't really be worsening over time. If you stopped chemotherapy 5 years ago. So yes, I would definitely agree with seeing a neurologist to see if there's any other contributing causes. And also, yeah, I would see them or someone else possibly in pain management to see if there's something else that you could do to get your symptoms under better control. I mean, my feeling is just like if you're having uncontrolled symptoms and it's bothering, the way you're living and your ability to kind of go through life, then yeah, it's something you should address.
Thank you very much.
Of course.
Thank you, Dr. Chang, for being with us. This was so informative. And there was so much information. I also added my email in the chat for anyone who'd like to copy of the recording just to review later, or there were so many tips and tricks and things like that that you could also try. But again, thank you, Dr. Chang, for coming here today and explaining chemotherapy neuropathy and all the things that can help alleviate the symptoms.